Good evening, everyone. Regular committee meeting call to order. Would you please stand for the invocation? Let's bow. Okay, president report, is none. Legal counsel report,
None.
none. Any calls, call for additions and deletions to the administrative committee?
There's one,
This is administrative committee?
Mr. Arnett wants to amend the 2023 holiday schedule for the Christmas holiday to change Friday and Monday to Monday and Tuesday.
Okay, and this will be item number 10.
So move.
Got a motion by Mr. Arnell.
Second.
Got a second by Mr. Mitchell, Mrs. Trina. Roll call vote, Mr. Dwayne.
Aye.
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 Aye. Aye.
Aye.
Aye.
Ayes have it. Motion passes. So that'll be item number 10. Change of holidays dates. Okay, any guest and public comments? We have one for a Miss Danielle Carhey for Misfits Dance Line. Are you in the audience? I guess not. We'll move on. Administrative item.
All right, administrative items. Item number 2, authorize the president to sign an agreement with Capital Area Finance Authority and the certificate of DeSoto Parish evidencing public approval of bonds pursuant to section 147F of the Internal Revenue Code 1986 as amended.
And there is someone here to speak on that item, if you have any questions.
Yeah, where they at?
Any questions from the jurors?
Yeah, I wanna know what this is.
All right. Okay. Had no motion, no second. We'll go to now item number 3. Accept the resignation of Latarsha Shelton and appoint a new member to the EMS board.
So move. Second.
All right, have a motion and a second. Any,
I don't have a name.
who do we have?
Mr. Bruce Carroll.
I beg your pardon?
Bruce Carroll.
Bruce Carroll?
Yes, sir.
Okay. All right, have a nominate Mr. Bruce Carroll. Do I have any other nominations? That's everybody? Okay,
Why we have to nominate?
is Mr. Bruce here?
Why we have to nominate?
Because the board is up under us. Because the board is up
I
under
don't see him in the audience, Mr.
up under us.
Okay.
That's his appointment though. How does get the appointment on? That was he.
All right, all in favor of Mr. Bruce Carroll, let's vote.
Green names could be appointed to have.
Your question?
I'm waiting. I think Ms. Burrell had a question.
Oh, I was
Oh.
just asking, if that was his appointment, why we have to vote on it?
We have to vote on
Yeah.
all board members.
Board members, to make it official.
Right.
It's an appointment by the governing body, Ms. Burrell, so it would be a vote by the jury.
It's more like his nomination, but they still have to be appointed by all of us.
Okay, I'm just asking.
Okay.
All right, passed. Item number 4, accept the resignation of Michael Rister from the Waterworks District Number 1 and appoint a new member.
So moved.
Does anybody have a name?
Do we have a name?
Get one?
We'll get one. Have a motion by Ms. Trina Boyd, second. Mr. Parker? Any nominations for Waterworks District Number 1? Do we vote to accept Mr. Michael Rister's resignation anyway, huh?
Yes.
All right.
Good question. Is there a certain district that that person represents? I know Water District, but which Drew?
Reggie's.
Who? Reggie's. Okay.
Mr. Parker. It's your district, Mr. It's in your district.
Reggie's.
Reggie's.
Ridge, oh, Ridge.
I don't have any problem, whatever they do.
Baker, Ms. Burrell.
Oh,
All right, motion to accept the resignation of Mr. Michael Rister has passed. Item number 5, rescind the authorization for jurors and employees hunting on any jury property.
So move. Second.
Have a motion by Mr. Jones, second by Mr. Rowe. All. Any kind of discussion?
When did we authorize? We okay?
Well, we don't quite know, so we're gonna do it the right way and go ahead and
just rescind it.
get rid of it.
Have you seen that in the minutes anywhere where we authorized hunting?
Not that I'm aware of.
So why do we have to rescind something we didn't do?
We're trying to clear it up.
Make sure it's clear.
Because some on there honey.
Make it a law if it wasn't one.
Right.
I'm like,
So it
Mr.
would be
Cook on
something
that.
people say they don't know, didn't know, so we got record now.
I got you. Thank you.
Sure now, Ms. Burrell.
Budge.
Y'all probably imagine if I can get it up there.
Okay.
Because those are brand new batteries.
Cause I'm normally
That
double link.
probably be-
All right, motion passed. Item number 6, accept the resignation of Michael Rister and appoint Tim McQuarrie to Fire District Number 9 Board of Commissioners and reappoint Ross Tillsbury and John Prince to the Fire District Number 9 Board of Commissioners for a 2-year term.
So move.
Have a
Second.
Motion by Mr. Rowe and a second, Mr. Kennington.
Mr. McCrary is out there in the audience if y'all wanna meet him.
Yes. Wait a minute, I'm confused.
Those are all of my
So
appointments.
he was on,
Those are my appointments in my fire district up there, fire district.
oh,
one.
no, this the same man we just took out of Fire District 1 and he going into another Fire District? Is that what I'm?
No,
Oh, no,
No.
Michael Rister was on both boards and he's coming off.
Oh, okay.
coming off.
He's coming off.
Coming off.
Matter of fact, he's
okay.
on 3 boards.
I'm just trying to get a clear understanding.
That's why he got paid so much.
So it's coming off, he came off of 1, he coming off of 9.
All right,
Y'all wanna see Tim McCrary? Tim, come up, please. Introduce yourself. Right up here at the front. He's a little hard of hearing too.
I'm Tim McQuarrie, yeah, I'm a lot hard of hearing, so,
Okay.
any questions?
No, sir.
no, sir.
Pleased to meet you.
Okay, nice to meet all.
All right, thank you.
Thank you.
Thank you, Tim.
Mr. Fuller.
Mr. Fuller?
Mr. Fuller.
I hear it.
All right, motion passed. Item number 7, reappoint Shirley Payne and Mary Thompson to the DeSoto Parish Tourism Commission.
So moved.
Have a motion by Mr.
Second.
Mitchell, second by Ms. Trina Boyd.
Is there a time frame on that one?
I think it's 6 years, but I'll check it. I'll have it on.
It's what?
I think it's
6
6 years. but I'll
6
check it
years?
to Make sure, yes, sir.
Any discussion? If not, vote.
Burrell.
Ms. Burrell? Thank you.
I missed the boo.
All right, motion passed. Item number 8, reappoint Michelle Abington Cooper, Margaret Dickerson, Leon Hunt, and Ernell Jones to the DeSoto Parish Library Board of Control for 5-year terms. Is there a motion?
I so moved.
Second.
Mitchell? Mr. Ross? Any discussion?
Yes, sir. Mr. Holmes, and my position on the library board is an appointed position by the police jury, president. It's not to be voted on, it's an appointment by him.
Okay.
So I go on every year, depending on the president. Represent the jury on the board.
So you want to scratch your name off?
Right, you scratch mine off.
I can do that.
So in other words, Mr. Jones is replaced by Mr. Ross?
Ross.
Right.
Is that
Well, it's
correct?
an appointed. If he decided to go on there for that, it's not a given to me, he's appointed.
Oh, okay.
Reggie always appointed me, then I appointed myself,
Like to stay?
so.
So you want to stay, that's good.
Mr. Mitchell and Ms. Simpson.
Hit that button. Hit that button. Do yourself.
Aye, motion passed. Item number 9, authorize the president to sign a resolution for the assignment of state agency lease number 20218 from SMEP, all of their rights, titles, interest in said lease unto GEP Haynesville 2 LLC.
So moved.
Is that a motion? Mr. Kennington?
Second.
Second by Mr. Baker. Any discussion?
Yes, sir, explain. I want to understand.
Yes, Ms. Burrell?
Can some, Ms. Lord, you can explain this to me?
In the packet, it just states that GEP Haynesville is buying out the lease of SMEP. And the lease calls for, if they sell their interest, that we authorize that sale. And Mr. Norton may know more. I just read the lease.
That's essentially it.
You can't get no text.
That was attached.
It didn't change any terms.
Okay, please vote.
Got Mr. Fuller and
Motion passed. Item number 10, amend the 2023 holiday schedule for the Christmas holiday to change Friday and Monday, December 22nd and 25th, to include Monday and Tuesday, the 25th and 26th of December.
So moved.
Second.
Mr. Jones, second.
So you're doing away with Friday?
Right, we're doing away with Friday and moving it to Monday and Tuesday. The governor's office, and I tried to get a confirmation from Representative Bagley's office that the governor's supposed to be signing a proclamation authorizing the state to acknowledge that Monday and that Tuesday as far as holidays to be celebrated for those Christmas holidays. And I had a poll taken among all our workers here at the police yard, all those associated with us, see how they felt about it. And I think maybe one or two of all our employees said they were for this. And I think the city is, and I think other municipalities as well, who are going to follow this particular pattern. So if all the employees was for it, because it hinders your vacation day, your holiday, if you gotta come back to work the next day. So,
Will that affect
That
all
close.
departments?
Yes, sir.
So compactor sites will be closed too?
compactor site work on a different schedule. They have to,
They're gonna be closed on Christmas Day.
But they'll be open on Tuesday?
That's correct.
Even,
They would-
regardless
They
of,
would have been open on that Friday as well.
Okay. Makes sense.
So that week, we make this change, our employees will work just Wednesday and Thursday unless we change the next holiday also?
New Year's Eve?
Well, New Year's Eve is recognized on the 1st, which is of the next year, so the 31st.
They don't get the
Yeah,
holiday?
I mean, no,
the
we'll
day
be open
before?
Wednesday, Thursday, and Friday.
Okay.
So we just closed that Monday?
No, close,
Monday,
right
Tuesday.
now, yes, for New Year's Day, it would be closed just that Monday the following
Just
week.
that Monday. Okay. So they'll work Friday.
Any more discussion? All right, motion pass. Have a motion to adjourn?
move.
Yeah.
Have a motion and a second. All in favor?
Budget and Finance Committee will come to order. Are there any additions or deletions to the agenda? Hearing none, is there any guest or public comments?
Oh, Mr., you do have one, discuss and take action on Keep Louisiana Beautiful parish-wide cleanup.
I so move.
I have a motion and a second to add that to
I'll
the
back up.
agenda.
I'm sorry, I'm not on your committee.
What are we adding?
What do we?
Yes, I am, I'm sorry. I'll second that.
Louisiana Beautiful parish-wide cleanup.
Okay.
Do I have did I have a motion?
Mr. Ernell, and I second it.
Mr. Arnett,
I can't do it. I'm not on the committee.
Ernell's not on my agenda, somebody else has to make
I'll
the
make the
motion.
motion.
And I second.
Okay. I have, Mr. Dwayne made the motion, Mr. Fuller and Ms. Trina seconded. Roll call vote of the, Budget Committee. Richard?
Aye.
And aye. Motion passes, be item number 2. Now, is there any guest or public comments on that added item? Hearing none. First item is amend the budget to transfer $120,000 from the general fund to the Office of Community Service.
So moved.
Have a motion, do I have a second?
Second.
I have a second. Any discussion? Hearing none. Y'all please vote now. Motion passes. Item number 2, discuss and take action on Keep Louisiana Beautiful parish-wide cleanup.
So moved.
I have a motion, do I have a second? I have a second by Mr. Fuller. What is the budgeted amount for this?
Ms.
I think she's gonna.
Huh?
I think she's, Ms.
Well, there is no budgeted amount for this. That's why it's being brought to the Budget and Finance Committee.
Okay.
Yes, sir.
Okay.
What is the amount we need to budget?
I think she's gonna come up and explain
Yeah,
that
she's gonna
to
come
us.
up and
Okay.
explain this. We don't,
who made the motion? I'm sorry.
I did.
Okay.
Hi, good evening.
Edna?
I'm Edna Stevenson, Director of Keep DeSoto Beautiful. Well, in the past, I know it's different now, but I never had a budget. I just brought it before Mr. Brown. and, with Mr. Wardell, and gave me permission to do it. All I needed was a little help, like from the employees. I had some volunteers on the board, but I don't have that many board members. So I asked for the police jury to help that day. It's a Saturday, usually from 8 to 12. We just gonna prepare the 4-H building, getting it ready with tables and chairs. We usually have a cleanup in the parish, all over the parish, from 8 to about 11:30, and reconvene at the 4-H building for food, door prizes, and music or what have you. Pretty much I've gotten donations and sponsors for everything else, like the food, the door prizes, pretty much everything else. But I just need the help from the jury with the employees. And looks like I'm gonna need about maybe 13 employees. And that's the drivers to bring the dumpsters to the site, one for trash, one for tires, maybe 1 or 2 people over the food. The inmates are gonna cook the food, but we need someone to man it and serve or what have you. We need probably about 2 to man the trash and the tires, because for one of the contests, we ask whoever have the most people in their group, we give them a prize. And whoever has the most trash, we give them a prize. So we need someone there to count that. We're gonna have raffle tickets passed out. I need someone for that. And if we need someone to pick up the trash along the parish, they let us know someone have to pick that up. It used to be, Mr. Bowie had someone to do that. So, and in the past, other cleanups, David used to do it. So just need someone to pick that up if we need some. The inmates may do it, I'm not sure. But for as a budget, that's the only thing, looks like right now I'm gonna need is the help of the employees, and that's about 13 of us.
What was the
And
date,
what's the
Ms.
date
Ennis?
again?
I'm trying to aim for December 18th. Everything else is ready to go. I just need you all's approval for that.
No,
And,
December the
Excuse me, Edmund, you said December?
November. I'm sorry, November 18th, which is in 2 weeks, which everything is else. Yeah, if they wanna clean up, they'll clean up. They can clean up and go vote.
True.
So, but this is one of the things that's required for my Circle of Excellence. We keep DeSoto beautiful. I must have a cleanup, and we got a grant for the cleanup, and that's the reason why I need to do this cleanup before December 1st, because I have to do a report. And if I don't do the report, we won't get the grant again. I applied for the grant. And the grant consists of litter grabbers, vests, trash bags, gloves, and T-shirts for the cleanup. So that's taken care of. So I have to do something with that grant to show them that we did use it and we need it, and to keep DeSoto beautiful and keep Louisiana beautiful, and it came from the state.
All right.
And I received $500 in Baton Rouge for being Circle of Excellence. I have to be on calls from time to time, by quarterly. So it's a job in itself, and to be Circle of Excellence, but I brought back $500.
All right.
Okay,
Yeah.
thank you. Is there any more questions? Mr. Jones?
11,
Yes.
yeah.
Mr. Chair, I'd like to add that, when we started this group is responsible for beautifying the airport, putting down the new shrubbery, the new trees,
Okay.
and also going around picking up trash all over the parish. We discovered Browns Road.
Oh,
Yeah.
yes, yes,
So that's when we discovered
Yes.
Browns Road.
yes.
And it's well needed, it's always well attended. And those people really enthusiastic about, going around parish, picking up paper and serving that purpose. So I would like to see us go ahead and sponsor that, continue to sponsor that.
Now, if I could add a little information, the reason this was asked to put on budget and finance was, according to the minutes, I think the last time y'all did a Keep Louisiana Beautiful event was in 2017? 2018.
Oh, okay.
And at that time, the employees who volunteered, they really volunteered. They did not come and get paid. Our employees are asking to be paid to work these events. So if that's the case, then the jury needs to authorize this event. If it's a true volunteer event and the jury has nothing to do with this, then, I mean, it wouldn't necessarily need to go before y'all unless we're spending jury dollars, even if those jury dollars are reimbursed by a grant. So there's a lot of questions, and this was just given to me last week. And in order to get this done before for her to prepare everything she needs to prepare for her report, it needed to be on tonight's agenda and needs to be ratified at the special meeting right after this committee meeting. So I wanted the jury to be aware.
Okay.
So move. Anybody have any other questions? Y'all please vote.
What's is it just to authorize?
Did he clear up the
staff
motion?
The budget?
13 employees.
Are we amending the budget for anything?
Yes,
Do we know amount or just amend the budget for Keep DeSoto Beautiful?
just amend the budget for
Okay.
Keep So Beautiful.
Okay, I got a second.
Keep Louisiana beautiful.
Louisiana.
Yes, sir, keep Louisiana beautiful.
Anybody second?
A second. Shouldn't be no problem. It shouldn't be no problem.
Motion passes. Motion to adjourn.
So moved.
So moved.
We're adjourned.
Move. You gonna approve the group L.
Insurance Committee called to order. Call for additions and deletions. Seeing none, guest and public comments. Seeing none, go to item number 1. Review and approve the best group health insurance proposals from the insurance broker. I believe we have some brokers here. I'll ask y'all to come up one at a time. Y'all can decide which one wants to go first. Y'all will have about 3 to 5 minutes to make your proposal to us and explain things to us. If y'all would care to come up.
Healthcare, BC, Cigna.
Good evening.
Good evening.
I'm Joe Hernandez. This is Sabrina Lane. We represent HPL Benefits as the current broker for the police jury's health and ancillary benefit plans. So first off, we'll start with the United Healthcare renewal. That is a 29% renewal this year. We were able to reduce it 2%, so it's coming in at a 27% renewal with no change in benefit. This finishes up our 8th year. We joined United Healthcare in 2016. And in that time, including this renewal for 24, the average proposed increases from United have been 13.8%. Through negotiations and 1 year of benefit change, the average final increase over 8 years has been 7.6% with United Healthcare. In 2009, we adjusted the maximum out of pocket slightly from $47.50 to $52.50. And that resulted in an increase from 28% down to 19%. We have proposed one plan alternate to reduce the renewal from 27% to 20%. That proposed change includes increasing the deductible by $500, so $1,000 to $1,500. Reducing the coinsurance amount from 80% to 70%. So that's the cost share of the employee and United share after the deductible has been satisfied. Also includes, increase in the maximum out-of-pocket by $750 to $6,000. We went back and looked. Since at least 2009, the police jury has had a $1,000 deductible. That has never changed. The out-of-pockets have slightly varied anywhere from $3,250 to $4,750, kind of depending on carrier. One time y'all were with Blue Cross. Even before that, y'all were with Humana. And so different carriers have different plan designs, so those numbers slightly jumped. But for the considerable past, it has been a $1,000 deductible. So proposed change, that's worth 7% in a renewal. Yes, ma'am.
Somebody been beating me then, cause my deductible been $2,000. I'm still paying
Let's
me.
not get into that, Mr. Morales. Let him make his presentation.
All right, well, come on.
We did solicit fully insured proposals from Aetna and Blue Cross. On the fully insured side, Blue Cross came in at 42% over your current rate as proposed to the 27% from United. Aetna was 32% over your current rates. So those are the options you have on the fully insured side. You're at a 27%. There's a proposal for a plan alternate at 20%. That covers the fully insured proposal. Does anybody have any questions on the fully insured options? Okay. We're also bringing 2 self-funded proposals tonight. Both of them are firm proposals. One is from United Healthcare, the other one is from Blue Cross of Louisiana. The United Healthcare proposal is a $100,000 specific deductible. So that is the amount, the jury is responsible for paying the first $100,000 in claims on every individual. If an individual claimant exceeds $100,000, then the stop-loss carrier will assume the claims above that amount. That matches the pooling level of the current fully insured plan. So those claims above $100,000 on the fully insured are removed from the factor, and so that matches the fully insured plan. The contract proposed, the stop-loss contract is a 12-12 contract. So contracts, claims incurred in 12 months, paid in 12 months. If you renew year 2 with United Healthcare under a self-funded arrangement, the contract goes to what's called a paid contract, which means if the claim is incurred during the policy, it will be paid by the plan. The key thing about the United Healthcare self-funded proposal is there is no disruption to the members. So it is truly a seamless transaction on the front end. The contract numbers don't change, the group number doesn't change, the employee doesn't technically even have to get a new ID card. Everything that changes the financial arrangement changes on the back end, not the front end, so there's no changes there. The expected monthly cost from United is $197,000 a month. That includes your administrative cost. Maximum monthly is $234,000. And then the prescription rebate, so the way United proposed theirs, they are proposing returning 80% of the pharmacy rebates back to the police jury, and United Healthcare keeps 20%. The original proposal had a $45 per employee per month credit, and it assumed United Healthcare would keep all of the rebates. We went back to them and told them they needed to make a better offer, and the return offer was an 80-20 split. The second proposal from Blue Cross, same specific deductible of $100,000, same contract terms, it's a 12-12 contract. Fixed costs are lower on the Blue Cross plan than the United plan. Blue Cross is projecting a little bit higher claims costs than United is. At the end of the day, it probably will be a wash as far as cost. One will probably cost the same as the other. Blue Cross is proposing 100% pharmacy rebate credit. So they ballpark that. There's no guaranteed amount. The ballpark amount is from them $33 per life. So you're looking at about $95,000 back to the group if you meet the average. That's the Blue Cross average on their book of self-funded business. Expected monthly cost $198,000. Maximum monthly cost $238,000. Blue Cross is also proposing an administrative fee credit. So to entice you to stay with Blue Cross for a 3-year period, within 60 days of going to Blue Cross, they will give you a $21,000 credit towards administrative cost. If you decide to get out within 3 years, they will prorate that back for 3 years. So if you leave after year 1, you owe them back $14,000. You leave after year 2, you owe them back $7,000. Just something for them to help keep you with them for a minimum of 3 years. Like I said, with both quotes are firm. The United quote is technically firm until January 1st, and the Blue Cross quote says it is firm through November 20th. So 2 week time frame there. And that doesn't require any additional claims information or anything. That's a firm and final proposal.
Any questions?
Can I ask you a question?
Yes, sir.
Blue Cross, you said Blue Cross of Louisiana, are they the same as Blue Cross Blue Shield?
Yes, sir.
Okay.
It's the same thing.
Okay.
Yes, sir.
Thank you.
Oh, I just wanna say, with United Healthcare, my deductible been $2,000, a $2,000 deductible. And, cause I'm finding myself in the position, I'm still paying hospital bills, still from 2020 with, United Healthcare. I really am. And, with this insurance company, if I go to the doctor the 1st of January, by the time I meet my deductible, they ain't paying for nothing because it's gonna cost me a $2,000 deductible before they even start paying any of my bills. I deal with it. I mean, if I go to the eye doctor, I have to have eye surgery. I end up paying the majority of that bill. You see what I'm saying? I have every bill that I get, no matter whether it's dental or if it's eye, go to the heart doctor. Same thing. I mean, at one point there, I wondered by the time I pay into this company and pay all these deductibles, I might as well save my money and pay my own bills because that's United Healthcare gets away with not paying hardly anything. And that's just the truth. I don't like the United Healthcare at all, so I can tell you that United Healthcare would not get my vote because I have experienced it firsthand, how they pay, and it's not well.
Any other comment?
Yeah, I was gonna let your committee go first, but if they're, I just wanted to know how many people are on the plan right now.
131 employees. Total lives, including dependents, is 240. And that has been, the 130 active employees, that's been consistent 5-6 years. At one point, it ran about 150 per month, but it's last 5 or 6 years, y'all been right at the 130 mark.
And is there anything, we can do, as a jury to, if we stayed with what we currently have and just renew it, is there anything we can do to reduce that $211,000 a month cost?
I mean, in a fully insured arrangement, I mean, you're subject to how the group performs. And if you have a bad claims year, I mean, we've run in the 90s.
I'm asking out of stupidity. I don't know. Is there anything out there that we're missing that we could do that?
To bring that too.
No, I mean, the claims have, I mean, this year to date, you're at 116%. So the percentage of premium that the jury's paid, United's paid out 116% in claims. Last year it was 96%. So in a 3-year average, it's been right at 98%, and that's raw claims versus premium paid in.
Okay.
So,
Thank you.
My wife, like I said, I have United Health through the police sure. I have Blue Cross Blue Shield through my wife's job as my secondary. Would this affect that as well? I mean, in any way?
they'll still be paid on like a primary, secondary basis.
Yeah. That's it? Okay.
Yeah.
Did you say, it's 80-20?
Right now, it's 80%, 80/20, yes,
So
ma'am.
we're 80.
So United Healthcare is 80%, so after the deductible, United Healthcare pays 80%. You as the subscriber pays 20%. Until the total deductible, co-insurance, and co-pays, until that total amount is $5,250. And then after that, you're done for the calendar year, and United pays everything after that.
100%.
Yes, ma'am. And the proposed plan designs on both fully insured match the current plan design
There we go.
that you have with United.
Any other questions?
What was the total current or annual for last year? You know, on top of your head?
Yeah, I can tell you. I believe it was 1.99 million.
Okay.
Is the current rate through the end of the year. So right at 2 million in annual premium. And then if you renew with the 27%, it's 2.5 million. So it's roughly $500,000 increase.
Okay. Thank you.
Miss Lily, these numbers that he's given out, the monthly numbers, is that the jury's portion?
No, that is the employee.
So we'll be
That's it.
75% of that?
Yes, sir. Yes, I just did it based on employees so you could see how it would affect the employees. But you will take 75% of those numbers, and that will be the police jury's portion.
Has anything changed with their medication,
To stay where we're at.
for its benefit wise?
We would be paying 100%.
I mean, all the same, there's no changes that we're aware of to the prescription formulary for next year. So whatever drugs are covered now
So
should
now
still.
it would be-
Now, the formularies do change year from year, but I mean, there's no glaring change that we're aware of that would affect anybody.
I mean, I'm asking because, see, I'm a diabetic. United Healthcare don't pay for nothing. Or my, like, the needles and my test strips or any of that. You know what I'm saying? They don't, I have to pay quite a bit. I'm on 3 different insulins. And I have to meet, as you say, those deductibles.
We will be paying
And
in the jury in order for.
I be out a lot of money in healthcare. United.
The current plan has prescription copays, and some insulins, I believe, are covered at 100% by United.
Well, I'm gonna have to ask my doctor what they are, cause it's not mine.
You see what I'm saying?
Well, we're more than willing to help you if you've got claims issues that, that's what we're here for, is to help the employees with any kind of claims issues they have, or billing issues for that matter. I mean, a handful of the jurors we have assisted in the past with claims issues, and it's part of our job here, so.
Any other questions?
Who else is here?
Thank you.
Okay.
Thank you.
Okay, so they did United and Blue Cross Blue Shield.
Next, please. State your name and who you with, please.
I'm Michael Dubriel, representing Hub International. Scott Brewster, 90 Degree Benefits. First off, I want to thank y'all so much for the opportunity to be in person and present to y'all, but also for allowing us to present a proposal. Colby Delahousse is my business partner. He couldn't be here tonight, but we both reached out to all of you about a month and a half ago just to introduce ourselves. I wanted to spend some time to discuss who we are at Hub, for those of you who aren't familiar, because we are not your current broker, so just want to give you a little background. We are the largest privately held brokerage firm in the world. On a more local scale, because that's really what matters, right? We are the largest writer of United Healthcare in Louisiana. We are, depending on which metric you use, the largest or second largest writer of Blue Cross health insurance policies in the state of Louisiana. We have over 70 municipalities that we manage the group health insurance program for. This includes parish governments, sheriff's offices, police juries, you name it. I say all this because I want y'all to feel confident that we're not only capable of managing your benefit program, we're actually the right partner for you. I also wanted to discuss, how did we get here? So we engaged with Lily and Michael about a year ago at this time, You all were not open or ready for a change at that time. But come this spring, that's when this conversation picked back up. And so Lily and her team asked us to complete a formal written RFP. We completed that. I have it with me, if any of y'all want to see it. We answered it within the guidelines that you all asked us to. And her recommendation was, because of the support and the resources that we could provide you and your employees, was to hire our team at Hub. After that, you all asked us, because you wanted to see firm proposals, to go out and get a firm proposal and get the best benefits and cost for your employees. So that's what we did. We went out, we shopped Blue Cross, Aetna, Cigna. We couldn't shop United Healthcare because that's your incumbent health insurance carrier. We also went out to other TPAs, which is how why I have 90 Degrees benefits sitting right next to me. We feel that they are the right opportunity for y'all. I know you're looking at your proposal. We're estimating about $600,000 worth of savings from your fully insured renewal. We feel they're the right partner. They're a local TPA. Their offices is right there in Shreveport, just a few minutes away. They're backed by a national carrier, Blue Cross Blue Shield. And so again, we're also structuring your benefit program in a way that your benefits are going to stay exactly the same. But in one of our meetings, I asked Michael, I said, where do most of your employees access care? He said, right here in DeSoto Regional Medical Center. And so what Scott and I did is we structured your benefit program in a way that if your employees can go access care to DeSoto Regional, which is where they access care usually, they're actually going to have a lower deductible. They're going to have a $500 deductible instead of $1,000. They're going to have a lower out-of-pocket compared to what you have today. If you're sitting here and you're saying, look, I really don't use DeSoto Regional, that's okay. We've gotten questions about other facilities and if they're in network on their plan, and they are. Willis-Knighton's in network. DeSoto Regional's in network. Natchitoches Regional's in network. Sabine, I believe, was who y'all asked us to check, and they're in network. So there's not going to be too much disruption to the program and to the facilities that you and your employees use. And our goal was to find lower cost benefits, which we did, and then also let's pump money back into DeSoto Parish. Let's drive people to use the local facilities, which is what we're doing by lowering the deductibles. So again, that's our proposal. I brought Scott here because rather than hear it from me as the insurance broker, wanted you to be able to ask questions directly to him. And he's happy to answer, and as well am I. Any questions that you have to make you feel confident and comfortable that this is the right move for you and your employees. So thank you.
Excuse me, I heard you name every hospital but Christian Schaumburg. Are they in network?
I can absolutely. They in network?
I do not know, but I can check.
We can check.
We'll have the answer tomorrow.
I can check right now.
Or check, he can check while I'm talking. And I'm gonna be really brief, guys. Thank you so much. This is a very emotional decision to make, right? Because it impacts everybody, both on an emotional, personal, and a financial standpoint. I think it's important to know, I've heard some issues here that you've had with claims, and the great thing about the United Healthcares and the Blue Crosses of the world is they're big and they're always there, right? But sometimes the challenging part is you can't pick up the phone and say, hey, Donna, this is Stan. I talked to you last week, and I've got a claims problem, right? So I wanted you guys to put a face with a name. We've been up here in Bossier City for 40 years. We're owned by Blue Cross Blue Shield of Louisiana. The reinsurance numbers you're seeing there are from a little company called Lloyd's of London, which, by the way, is the biggest insurance company in the world. So there's a lot of largesse behind what you're looking at there, and it's important to note, and then I'm gonna be quiet unless you guys ask some questions, but the numbers you're looking at there is what's called a 12-15. So we've actually, sometimes when you go self-funded, you can buy a 12-12 contract, which means claims have to be incurred in 12 and paid in 12. And when you renew next year, you're going to get a bump because you have to mature your contract to cover run-in claims. Instead of coming in here and showing that, we decided to show you a 12.15. So we've already baked in next year's contract increase. So really, next year, when we come back together, your increase is just gonna be based on your actual experience, which you might think, why are our numbers so much lower? It's because as an independent TPA, we were able to go to 15, 20 different carriers to shop different reinsurance carriers. Lloyd's of London was best. Lloyd's knows that we do some really aggressive things with prescription drugs. So because they know that, they were really aggressive with the rates for you guys. And then you top that where we have a lot of projects going on around the country with Lloyd's of London, and they got really, really aggressive because they wanted to help us here. So with that being said, any questions?
Ms. Burrell, I wanted to answer that question. We did email them, and they did reply, and Christus was in their network.
There you go. My apologies for not saying it.
You had mentioned a decrease in deductible to DeSoto Regional 500. What about, some of us live closer to Shreveport.
You would still have the same benefits that you have today, which is $1,000 deductible. So that doesn't change. We matched your benefits for what you have today, just we wanted to steer people locally to DeSoto Regional, incentivize them with a lower deductible and out-of-pocket cost. So your benefits that you have today are not changing. If you go see Willis Knighton or another facility, you're still gonna have the same benefits that you have today. If you go see DeSoto Regional Medical Center, you're gonna have a lower deductible and out-of-pocket.
I have a question. I know you said that the benefits would not change. I'm looking at, you know, the deductible, the out-of-pocket, the PCP, the specialist. So you're saying those things would not change? Is that what you're saying?
That's correct. That's what I'm saying.
My question is, I understand what you're saying verbally, you're saying they would not change, but for me, it would have been better for me to see it written, because you're telling me verbally, but I don't see it written. I'm going off of what you are telling me.
Okay.
You understand what I'm saying?
No, I understand that.
And the other thing is, you said the $600,000 in savings. I would like to know what some of those savings would be. It's easy to say, we can save you $600,000, but again, I'm a visual person. You can easily tell me.
Did we not provide that to you? Because the annual expected costs are about 1.5 million, and your maximum liability on our program is 1.8. So it's 7%.
It's right there.
It's right here? Okay, I see it.
So it's 7% lower than what you're currently paying today with
Okay.
your United Healthcare plan.
Okay,
And it's about 24% lower than your renewal. That's the most you would pay. That's if everything
Okay.
hit the fan claims-wise, which, again, we're not expecting that to happen.
okay.
And on the benefits piece, you know, I apologize, but we mentioned this to Lily and Michael during our meetings, that the way we're structuring the program, and I thought we had sent it, so I apologize if we didn't. We wanted to keep everything the same. We did not want to lower the benefits for the employees. And so, again, benefits are gonna stay the same. You're gonna have a lower deductible, and if I can find it, I'm happy to send it out, but I know it may not make it to your desk.
All right, thank you.
Any more questions?
I have one, but it's not really to these guys. I think it's to whoever presented or prepared this. Is that,
I did,
so the maximum numbers on those columns,
yes.
that includes the maximum 100,000, 75,000, 80,000?
Yes, sir. That will be, the max will be.
That's the worst case scenario number.
Worst case scenario number. And as far as budget purposes, if y'all chose to go the self-funded plan, I really want to do that as the expected amount for budget purposes.
And Mr. Kennington, if I could add one thing to that. When you're a new group that's considering going partially self-funded for the first time, it's sometimes comforting, because you can take that maximum cost, right? If that incurred in the second month of the year, right? I mean, we all know that COVID, for instance, could come through, right? So worst case scenario, you couldn't take the second month of the year and have all of those claims in the second month, because you couldn't budget very well, right? So what we did on a group your size is we took the maximum annual exposure and we bought what's called monthly accommodation. So it takes your monthly maximum, it creates a monthly maximum from your annual maximum. So there's a set amount, you can't go over that annual total divided by 12, the reinsurance kicks in. If that number is $100,000 and you have $115,000 of claims, we pay the $100,000, we request from Lloyd's the 15, you can't ever go over that maximum monthly allotment. It's real important to get that coverage, but otherwise you could really be in trouble by having a lot of claims in 1 month. Just worth noting. Does that help or confuse?
Yeah, I just want to know what that number represented. I mean,
It represents all claims, both medical and RX, under the $80,000 stop loss threshold. So if John is one of your members and he has a $150,000 claim, we're gonna process $80,000 out of the claims fund, 70's reimbursed, so that anything 80 and below goes towards that monthly max.
Any other questions?
I'd like to make a statement and ask, you guys are brokers, right?
I'm a broker, he's a third-party administrator.
Third-party administrator.
Yes, sir.
You know, whenever we're in here and deciding on insurance, and it sounds good when we're in here, but when you get ready, when you need it, especially buying medication, you go to one of the, medication you've been using all along, they say, well, your insurance is not paying for that particular medication anymore, or this particular medication is going up. You know, when you guys come, it sounds good up until you need it. And for a long time, many years, I never needed it. But the last year, I kind of got some health issues, and I needed it. And that's when you see the bad side of it. You know,
I think,
like medication or
I think it's well documented that health insurance in America is broken, right? The healthcare system is broken.
Right.
Our job is to bring you the best value and the best benefits that we can. It's not always gonna be perfect, right? But in your scenario, we have a team that's dedicated to helping you in that need. So our goal is to always, one, proactively look at pharmacy benefit managers and make sure that any prescription that you need to take is gonna be within that PBM, so that the insurance can't deny it, right? But if we run into certain scenarios, we have a team, and we've discussed this with Lily and Michael. We have an entire team that's dedicated to helping you get that prescription drug filled and working with your providers and working with the pharmacy to make sure that you don't have any disruption. So again, I'm not gonna sit here and say that your plan is gonna run flawlessly. Your plan with United Healthcare is probably not gonna run flawlessly. We've heard today that it hasn't. But our goal as your broker and your representation is to do everything that we can and provide you the resources to make sure that when you do have a need, that we get it done as quickly as possible. And that's what we do for our clients, and that's why so many people trust us.
Okay, so when we have issues, we call you rather than the insurance company.
That's right.
Okay, gotcha.
That's what I'm talking about.
We're here for you. So I don't want you to call the insurance company. They're gonna you're gonna call a 1-800 number, they're gonna give you the runaround. I want you to call me.
Any other questions? Thank you.
Thank you, guys. Thank you.
Thank you.
We do? We got another?
Anybody else?
Good evening. Good evening.
Who's actually on the finance committee? Can I pass that out? I want to reference one page in here.
The insurance committee?
I only got 6 of these, so I only want to reference one page, so y'all do what you gotta do.
Yeah, that'll be. Mr. Parker, Mr. Mitchell, Ms. Simpson, Mr. Holmes, and Richard Fuller.
You can pass them.
she's one. He's one, man.
Well, y'all can share. All right, well, you know, it's an insurance meeting when you got all the suits in the audience, so I feel like it's kind of a matrix, right? So, my name's Jason Wineland. I have a local firm called J. Wineland Group Benefits. We We were acquired, we're a part of the Alera family now. We're not the largest broker, we're 10th or 11th, whatever. So we have a local presence, we have a local team. It's me, Havard, who's an actuary, my face back there, Robbie, and my lead case manager, Raymond Norton. So we are probably, in my opinion, some of the foremost experts on self-insurance. I've been doing this my whole career. I used to have a third-party administration company and competed against that man right there without any hair. And then I went in the brokerage business and the consulting business. So we handle the police jury, we handle the bank hearing, we handle the hospital, okay? And we've transitioned them all from fully funded, like you are now, to self-insurance. And it's a tricky transition, okay? A lot of promises, there's a lot of moving parts. And 5 minutes, I can't do it justice, so I'm gonna paint it with a broad stroke and address a couple of the concerns that I've heard. So we started shaking this tree early this spring because a couple $1 million is way too much money to have on a fixed premium basis. Okay? So that kind of money on a self-insured basis, when we can control claim cost, it's claim cost and large claims that's driving your healthcare cost. Okay? The benefits are largely irrelevant. So I counsel my clients to have good benefits. Okay? Use them for retention and recruiting. Because if you think about it, a $100,000 claim, okay, costs the insurance company a whole bunch, costs the employee a little bit, not too much. So it doesn't really matter what the benefits are. Have good benefits, have good prescription drug benefits. Make sure you got someone who knows how to control and work with you on your claim cost. The whole thing about going self-insured is minimizing your fixed costs, okay, your reinsurance cost, your claims administrator, your broker fees, and then trying to control the tail wagging the dog, which is your claims cost, okay? And that's a function mostly of large claims. So our proposal is running a hot second, okay? But I want to direct you to in the presentation, the first section, go to page 10, please. So most of our job as consultants is to educate our clients on how this stuff works. It's confusing, but really it's just math, okay? So on page 10 there, I have highlighted two numbers. The one in the middle, okay, $1.4 million in claims. You see that number? Those are your claims through September, okay? So I got an actuary, we got all kinds of claims people. So our quote on that presentation is firm and it's accurate, okay? The second number in the third column there, the $2.2 million number, minus stop loss and minus rebates on the third column, that's what we're projecting your claims to be in 2024, okay? So we can talk about rebates, we can talk about stop loss contracts, all that stuff that is just tons of details that your brokers are supposed to know and will know, but you gotta have someone that does this every single day, day in and day out. It's just like any other part of any business. You've got to have the experts working for you, okay? So my point is that when you look at our presentation and our quote, it's not the lowest, but it's accurate. And nobody wants to be sitting at this table next year when it blows up, okay? So I'm not gonna say it's gonna blow up, I'm just saying that ours won't because I think it's accurate, and once we plug in the kind of contract, the contract things we want to do with the prescription drugs and some of the claims management with our, yeah. So, and there's various stop loss contracts, my buddy's pointing out here, that open up certain liability, uninsured liability to the plan. I don't want to talk about all that. All those holes are plugged. But I mean, the issue is it's a very complicated decision for y'all to make, and it has to be made, with your eyes wide open. Our proposal uses a local third-party administration company, actually down in South Louisiana. We're using the Cigna network because we didn't have access to United Healthcare. That's the easiest, United Healthcare is the easiest transition for your employees, okay, frankly, because you can, but you can place the stop loss on various different TPAs, okay? So yeah, the streamlined one is to go with United Healthcare, but we don't have access to that market. So we used Cigna, which we have a lot of local clients in the Cigna PPO network. Cigna does not have a big commercial insurance presence in North Louisiana, but they have a good network because they have lots of big contracts from providers. So I know that's a lot, and I'm moving fast, and that's full of numbers, and that's the kind of detail that you'll get with every renewal that we do. We go through the financing, and you don't have to come to a meeting in November to know what the renewal's gonna be, okay? Because that's all lined out in about June or July. You see what direction the plan's going, you know what steps you're gonna take, and by this renewal meeting with my other self-funded clients, we're just making decisions on what we're gonna do, and that's the end, right? It's a 5-minute meeting and we're done, because we already know what the trends are. We know what the costs are. So that's the value. So whatever you do, you need to get off the fixed, in our opinion, you need to get off the fixed premium basis and go self-insured. That was a lot. I know it's moving fast.
You know, you said the claims were 1.4 million through 9 months and 1.8 million last year. So realistically, you're not gonna come in at $1.8 million next year without a 40% discount in claims, which is, nobody's network is stronger than United's or Blue Cross. I mean, Cigna's close, but they're all the same.
So we're talking about the hospital discounts. I mean, right now, United has good discounts, okay? So you're buying healthcare services at a lower discount, all right? So the network matters. All these pieces that are involved in there that we could talk for hours on matter, and they're each separate. I mean, we negotiate our own PBM, our pharmacy contract. You know, we plug in the broker is here to plug in all the best pieces for you. And it's complicated. I mean, it's a lot of meetings and it's a lot of work, and it's way too much to cover in my 5 minutes, which I run over probably by about 5 minutes. But we have a local office to service our people.
Can you still provide most of all the same networks?
Yeah, can we still provide what?
The networks. Do you still provide the same network as?
Yeah,
almost.
Yeah, so our proposal is just based on the SIG network because that's what the TPA is hooked to, okay? Other TPAs have other, you know, if you want the Blue Cross network, you gotta have the Blue Cross claims payer. You want United, you gotta have United. So a TPA environment allows you to plug and play the various components you want, and that's how you wanna run your plan. It's like any other piece of your business. The more you manage it, the better it's gonna perform, right? I mean, when you're on a fixed premium basis, 1 meeting a year, that ain't no way to run a railroad, right? So, I know, I'm plain spoken, half the room hates me, half the room loves me, so we'll just leave it at that, okay? Thank you. Got one fan.
Any questions?
You brought him with you.
We appreciate your time. You got a question?
No, I was thinking you asked me.
Yeah, you bet. Thank you, guys.
Presentation.
All right, we're through with all this. Need a motion from you.
We got one more.
We got one more? Okay. I thought we had 3.
I just want to come as a guest, make a public comment. I didn't hear that earlier. I missed that part. So my name's Robbie Latham. I know most of you guys know who I am. I'll be taking over District 2 in January. I just wanted to offer to the jury, I'm an insurance agent, and I know that insurance is complicated.
To say the least.
And you guys have a $2 million decision to make. So I just want to offer to the jury, I'd be glad to look over the proposals, talk with the brokers, and give any kind of advice to the current jury that you may have or whatever. So that's all I wanted to say.
Thank you.
I don't know if it's legal or not. Is that legal?
All right, now we're open for a motion as to which one of these plans you'd like to have.
We got to choose one.
We got to choose one tonight.
What's our, what's our deadline? What's the deadline? Our deadline?
November the 20th, I think what he said.
It depends on the plan you pick. If you go with
Oh, yeah.
UWH, you can defer this to the next regular meeting and we'll be fine.
Yeah.
If you go with either one of the others, we have to set up the plan. There's a process that you have to set up.
Our next meeting.
Specifically, if you go with one that's not UHC, we're gonna have to, education begins tomorrow on a new plan, And it's gonna take us that amount of time to make sure all the employees are on the insurance come January 1. So there's a process that we have to set up if you choose to go self-funded. We don't know what that process is. We're learning this because this is brand new. So that's why the jury needs to make a decision on this, and we ask that y'all make a decision tonight.
I have
Man,
one
I don't know,
statement.
that's too much to look over.
You can't make a decision tonight. There's no guarantee. I don't know if we can get the insurance, everything
I have one
set up,
statement.
because we don't know what that process is.
Mr. Kenny,
Oh, I'm not gonna make a
Yeah, I mean,
decision.
as far as making a decision tonight on $2 million, the only thing we got was a
Right.
office and was this, presented by your, or typed up by finance office. It doesn't list anything but an expected cost and a maximum cost, and has a few numbers on the sides. I'm not gonna make a $10 decision based off of this, much
Okay,
less
well,
a $2 million.
This is what I asked the jury to do. Y'all give us the exact information y'all want tonight, and we will give it to you. We will do our best to get each of the brokers to provide that information to us. Now, we need y'all to give us direction. So if you want RX claims information, we can give that to you, but we need some direction from y'all. I don't know what else we can present to you. I mean, we can give you this huge packet of information.
That'd be helpful. I'm not on his committee, so I can't vote tonight, but
Well, this
committees-
is just a committee meeting. We can have another committee meeting later on.
Yeah,
We can have another committee
Committee
meeting
meeting.
later in the week.
Before the
So-
20th.
Yeah, 'cause it's too soon for the
I
night.
think that's what we need to do
Yes.
is have another
We
meeting
need to
on
have an
this.
alternate motion.
Okay, it's getting the information to y'all that can be challenging, because not everyone checks their emails.
Okay.
And, I mean, if y'all can tell us you're gonna be here tomorrow or maybe Wednesday to pick up a packet, we'll do our best to get everything from every broker to y'all to make that decision.
I was gonna say, I have the information, so I can easily make that, make the copy, send it to you. My point in doing this sheet was just trying to simplify everything. Now, I have talked to all three brokers, so I think time-wise, as long as we make a decision by the November 20th meeting to go ahead and decide what plan we're doing. Are we staying with our broker? Are we going self-funded? Are we staying fully insured? That just does need to be made by the November 20th meeting.
Mr. Parker?
I'm good with that.
go ahead, Mr.
Well,
Kenny.
well, for me, and I'm only speaking for me, whatever the brokers or the different companies sent to us as their proposal, that's what I want to see. I want to see all three of them.
Yes,
No
sir.
less or no more. And I'm not knocking your sheet. I appreciate a summary of your sheet, but ask me to make a decision tonight
Correct.
under the
I
gun
completely
based off of
understand.
that.
Yes,
That
sir.
ain't
And
happening.
like I said, I have the proposals. It's just a matter of printing them and emailing them to you.
Yeah, and it shouldn't be hard to put those in they're smaller than a tax return, so it shouldn't be hard to email.
I make a motion, we, get the information we need, get, Lily to
Yes.
furnish that to us, and let's reconvene possibly Thursday
Right. I'm not on the
with the,
committee, but I'll
with
go.
the
I agree with that.
insurance
Got a
committee.
motion, do I have a second?
Second.
Second by Mr. Fuller. Call a roll call on it, on the vote on this.
Yeah, roll call.
Discussion. We have budget meetings Thursday.
We know,
You know that.
right,
It could be in addition to that, couldn't it?
right.
Yes.
Yes.
Exactly.
I can
Yes.
get us another committee after the budget.
So we're doing it after budget?
After budget
Read,
meeting.
read the motion to us, so
Defer to Thursday after budget meeting.
we'll have a insurance committee meeting
Okay,
after the budget meeting this Thursday night.
Coming Thursday.
all right.
Roll call vote.
Aye.
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 Okay.
I have a question. So will we get the information that we need?
We can have
Yes.
it printed for you tomorrow.
Okay, thank you.
Motion to adjourn.
Adjourn.
We're adjourned.
I don't know enough yet to make up my mind.
Come on, candy. I don't need.
Solid waste.
I call the Solid Waste Committee meeting to order. Ask for any additions or deletions to the agenda. Hearing none, any guest or public comments? Hearing none, solid waste items. Approve high quote for scrap pickup at the Monday landfill.
I move to discuss it, so we can discuss it.
Make a motion.
I have a motion to discuss or whatever, whichever way. Do I have a second?
Second.
Mr. Fuller made the motion, Mr. Holmes second.
For discussion.
It's open for discussion.
If nobody else wanna say anything, I wanna say this, okay. Now, I remember a while back, I asked for the, I had called and asked for the bids on this particular item. And from what I received, it was only one bid. That, I'm trying to see, how did that one bid get overwritten and we bidding again? Cause to me, somebody done broke the bid law. You know, they take that real serious and it can get this jury in a lot of trouble. Because I have copies of this bid, and I know the bid, didn't nobody bid but one time, cause I often get the bids on pretty much everything we do, because I wanna make sure that we're in compliance and not breaking the bid law. But I do know this bid.
What
Yes.
company was put a bid in? Okay.
Yep, Mr. Bedsout, that's who got the bid.
I guess whenever you get done, can I go over the steps that we got to this point?
Yeah, when I called down here and asked for the bids for that particular thing, cause I had called and asked for bids for 3-4 different things, the porta potties, it was 3-4 different things that we were doing, so I was getting the bid. I do know this bid here, I mean, it was the same thing with the tree company. Some mix up with the bids went on with that. We can't keep doing that. We gonna have to be consistent, especially with these bid laws, cause they don't play with the bid laws. And it leaves this jury vulnerable to a nice little lawsuit. So, you can tell us what you saying,
Okay.
Miss.
Mr.
Yes,
Chairman,
ma'am.
I have a point of order real quick, or point of information. The bid packets that we got sent, hand-delivered, and the bid packets that we got via email are different than the numbers that are on our desk tonight. Is there a reason for that?
I just noticed the same difference too.
Yeah.
I don't have an answer for that.
Yes, sir. That was my mistake. And like I said, I would like to take this opportunity to explain how all this started. We put a formal bid out back in August, advertised it through the Mansfield Enterprise. And that bid, it was a sealed bid that was due on Friday, August the 11th, 2023. And it had specs on what we were needing as far as having pickup from, have a pickup at the compactor side, have some at the Monday landfill. The only person that submitted a bid was Mr. Blake Bedsoe for A&H Rentals. Now, that bid opened, like I said, August the 11th. It was due to us at 2 p.m. It was posted on the newspaper and it was posted on Bid Express. And Friday, August 11th, 2023 at 2:26, we got an email from Mr. Blake Bedsoe withdrawing his bid. This is why this never came back up here, because he sent us an email saying he had not read and fully the specs of that bid, and he was withdrawing his bid. So that's what happened there. So after that, we sat with the assistant superintendent, and since he withdrew his bid, and there was no other interest from, anybody on Bid Express, nobody else, we were trying to just go ahead and get that cleaned up so we could take care of what needed to be cleaned up. I think there's a whole bunch of scrap right at the hill that needs to be taken care of because I think it's in non-compliance with the DEQ. So we went back out and contacted companies around here. And instead of going back out to bid, instead of doing the whole advertising again, we just went ahead and asked through phone for them to send us a quote. So we went ahead and got the other companies that send us an email, and you will see this sheet that was presented to y'all. So my mistake on Mr. Bedsole was that he sent me another quote that I did not pull when Jennifer made this sheet. I mistakenly did not pull the last quote that we got from Mr. Bedsole. So that is where the $20 difference comes in. But all my other ones, and he sent this to me September the 14th. September the 13th, we got the quote from Coshada Iron Metals. And then the one for CMC Recycling, that actually came August the 17th. Those other two companies went out to the landfill, met with, CMC met with David, and Coshada met with Mr. Josh. So they sent those through email. So it was not a formal bid process, so we did not break any bid laws. It was, and we can do that. Anytime that you're calling for a service, there's nothing on the state law that requires you to get quotes because it's considered a professional service. So you could actually go ahead and just call somebody and they can come do it. But I'm always, trying to go above and beyond. So we called 3 other people. And this is how we come up to Coshada Iron being actually the highest because CMC, it's not quoting us as far as picking it up from the landfill. They're requiring us to take it to them. And based on calculations of how much that will take, roughly 2 hours, that's $393 that we would have to spend. So we will actually be losing money if we did that. And these quotes were just for them to go clean up what's out there currently. We were going to take it back out to bid for the long term.
Let me ask you this then. Okay. Did we or did we not have to pass getting permission for this to go to bid? That's the first question I'm asking. We had to give permission. We gave permission for this to go out to bid, right? Second of all, what I want to know is why, Mr. Bedsole, can you tell us why you withdrew your bid or whatever she's saying? Because
Yes, I can. I can tell you why.
Can you come up, please?
Is because y'all had it to where y'all wanted the dumpsters to go on site. And I got scared to where if somebody fell in them dumpsters, I didn't want to be reliable. So I did withdraw my bid for that, but then I was told to bid it again to haul it from the landfill, which would have been fine. And that's what I did. And then I was told again after that to bid. So I actually have bidded it 3 times. I withdraw the first one. The second one was me and CNC, and then Kashada come in here from, I don't know where Kashada come from.
Can I ask a question? You were told by who? I mean, you said.
Michael Norton and David O'Mara, is what I was told. Them are the only 2 I've contacted with. And then he told me to send Lily the last bid. David told me to send the other one to Jennifer.
What was the last?
$20.
That was from last Wednesday to today?
No, this has been going on since August the 1st. My last email was
September
September
14th.
14th. And there's one in between there.
Mr. Chairman, I just got one question. Why would we bid it one time and ask for quotes the second time? If we were gonna bid it the first time, why didn't we bid it the second time?
You didn't have enough people bid on it.
Who bid it?
I think
Mr. Blake.
Mr. Bledsoe bid it, but then he
withdrew.
I withdrew it because of the dumpsters. I didn't want to go to the sites with the dumpsters, so that's why I
So
withdrew.
at that time, there was nothing left there wasn't nobody on it. So since it's a service in actuality, you don't have to bid it, you can quote it. So they went out and tried to acquire quotes, which Mr. Bledsoe turned in a quote for that.
I've turned in two, Mr. Baker.
Did you?
Yes, sir.
Who determined to bid it the first time, or why did we arrive at bidding it the first time?
Because we had so much trouble in past history that we wanted to get things written down that we wanted them to bid, so we could actually have it all spelt out, so we wouldn't get into drama that we got over the last fella who did it.
They didn't pay for it.
But did I hear, is Ms. Burrell correct that we authorized them to bid it the first time?
I believe so. We authorized it to go out for bid. But we didn't get enough people to bid on it. So usually when we don't get enough people to bid on something, we go out for quotes.
We didn't do that with the tree business, we just rebid it.
Yep.
Well, I mean, we gotta be consistent.
Well, and let me clarify, the first bid was to do a long-term scrap metal pickup. The quotes that we went out to get was strictly because the previous superintendent was trying to go ahead and just get rid of it because according to what he told me, it's in violation of DEQ. So he's trying to go ahead and get that taken care of. And instead of me having just to call somebody to come get it, we want to make sure we got the most price out of that, and this is why we went to get 3 quotes over the phone and through email.
I mean, you telling me that, Ms. Garcia, y'all telling me that, but what really disturbs me, we had a man didn't pay a bill from 2019 to now. And
Now,
y'all gave
just
him,
to put this on record, I have sent him an invoice and he's paid in full.
I mean, when we gave y'all permission, first of all, we didn't give y'all permission to do that. We did not give y'all permission to do that. Second of all, you telling us about this high bid, but yeah, he was able to pay us chump change compared to these bids we looking at now, or quotes, as you say. So he really got away with stealing thousands of dollars from this parish. Second of all, we passed the jury, this jury passed, that we was gonna use our local people first. I remember when we passed it, Reggie made the motion. And I done forgot who seconded it, but we passed to use our local people first before anybody else. This is one of our
Hey,
local people.
can I interrupt you on that? As far as using local people, per state regulation, you cannot go ahead and do that. When you're talking about bidding, breaking the bid law, you cannot go ahead and put those assumptions as far as local.
Discrimination.
Well,
And I
y'all
understand
passed.
what you're saying, and my thing here is we're bringing this up to you so y'all can decide. You don't have to give it to the higher bidder. You could give it to Mr. Bedsoe if that's what the jury choose to do. As far as us, the administration, we were just trying to get that out of the way.
I mean, I'm just being honest about it, and that really disturbs me. We gonna give it to the highest bidder now, but then when we trying to get paid for that didn't get paid for, how much it was, $1 a ton or whatever. Now
Okay,
we
and that was prior to me, and there was no written agreement. This is why we were trying to go ahead and bid it out so we could have everything in a written agreement. So without any written agreement from the previous person that came and got that, I didn't have anything to stand on to try to go ahead and tell him these were the prices at that time.
Okay, then still, like I said, y'all presented us with that, but we never gave permission. It was okay to send him a bill, and that was the final cost. We did not pass that.
Mr. Chair.
Yes.
I have a question for Mr. Betso. So your current bid is different from what on this paper here?
Yeah, I've seen that the first time I seen it tonight. I've never knew if I lost it, won it, what. All I know is I got wind from the street committee that they were fixing to haul it out.
Street committee said ain't.
That's right, baby.
So, Miss Lily, so you said CMC is gonna cost us $309,
$393
$393, and that
per
third cost.
load.
Per load.
The Kashada's charging $200 per load.
Correct.
So, we're only gonna make $100 if Kashada.
With Kashada, you're looking at about $60 per ton. Because their trucks, they can haul off to about 5 tons. So it's $100, so let's say they can haul 5 tons, it's 500 minus 200 is 300. You divide that by 5, it's 60 per ton. CMC Metal, like I said, I did an average of what our current drivers make, and then took the FEMA rates for the equipment for the roll-off truck that they would use, and that's at $174 per hour. So I figure 1 hour one way, 1 hour back way, and that came to $393 per load.
They can haul 5 tons per load, you say?
Yes.
The jury is
What
not
is-
equipped to haul more than 2 to 3 tons per load. So if we have to haul it, we haul
No,
less.
I'm talking about the one y'all want to
Correct.
award it to.
Yes, sir.
They can haul 5 tons a load?
Yes, sir.
Yes.
How much money?
And what is Mr. Betso's, tonnage price?
I'm gonna haul you 10 tons out of that sun gun at a time when I roll your scales.
How much per ton?
much per ton?
Did you bid?
$20.
$20.
Yes, sir.
That's what we were wanting to find out.
You can haul 10 tons?
At one,
At one time.
What does that come up to, Mr. Kennington?
You
It
can't do,
doesn't-
He letting you
200.
punch on that calculator
You're the
up
one that
there.
got the calculator.
Pick a number, man.
Reggie, it doesn't matter how much Mr. Bledsoe can haul per time because he's not charging us a transportation fee.
Exactly.
All he's giving us is $20 per ton, okay? That's all he's giving us.
Yeah.
Other one's gonna give you $100 per ton, but then you gotta subtract his $200 transportation fee. If the other fella hauls 5 tons, Miss Lily just did you the math, and what did you come up with, Miss Lily?
$60 per ton.
$60 per ton.
Well, the reason I said a lower number is because, here's the deal, if I would've told y'all, if y'all would've took that 3 months ago, when the prices are down, they could be up today. It's just like the cow market. It fluctuates every week. I mean, I'll pay you whatever the day rate is when I haul out. I mean,
but right now, I mean, according to what they're telling us right
Right.
now, they're just doing it
It's
based off of
flat
what's
rate.
out there. So you
That's
know
right.
what's out there.
I've seen it out there.
So, I mean, you know what kind of metal it is.
That's
You-
right. It's just pretty much rated as 10 unless you're gonna sort it.
Is she gonna what now?
Sort it.
Oh, yeah, sort it out.
Mr. Baker,
Yes.
these, I'm gonna get something clear. These quotes are just for what's filed out there now, is that correct?
Correct. Correct. Our plan was
Then what are you gonna do when they remove that?
go back to doing a formal bid with changing the specs. Because like he said, he's not the only one that pointed out that on those specs, everybody was kinda, leery about putting containers out there that belong to them. So we were gonna sit back and look at the specs and see, okay, what kind of different specs can we do? Can we go ahead and just get them to come once a month when we call them? And then the previous specs had it to where, they had some at different compactor sites. So pretty much we were thinking of taking all that out and just putting it to going ahead and asking for 2 containers at the landfill, for the company to bring 2 containers.
Now, I have made the remark that y'all could haul it to me since I'm centrally located in the parish. And when this guy comes across the scale and dumps it, I can give him a ticket to take to the office, and I have a ticket, and then I pay y'all monthly instead of double handling it. Because you're gonna haul it to the landfill, then you're gonna take a traco, put a hand up there. And yeah, we can pay more money whenever you're coming across the scale. Or we could use the road department scales. And then he could dump that there and go back to Long Street. Say he comes from Stonewall to my place, dumps there, and then goes to Long Street or Logansport. You just cut halfway across the parish of fuel of what you're saving and time.
I don't think this scrap iron comes from the land,
It comes from Stonewall. They have a bin there. They have a bin at
this for
Linwood.
scrap iron?
Yes, sir.
Metal bin.
There's one at Frierson, I think.
So when
too.
you, I mean, there's not one at every compactor
No,
site.
sir. There's only about
All that
4.
scrap iron's gonna end up at the landfill. It's
Correct.
got to.
Well, they have some there, when people bring them out there, but I'm talking about at the sites, that they have at the sites.
Blake, will you, if you picked up the scrap metal from the landfill and hauled it to your place, you're gonna essentially sell it to somebody?
Oh, yeah.
And you'll pay taxes off that, right?
That's right.
So right now, you're at $200 every time you take a load. We're gonna make $200 off of you.
Then
We're gonna make
it back off my
$300
tax
off
money.
of Kashada.
But then you're gonna get it
So-
back on my taxes and what I spend in the parish, my equipment that I buy,
And fuel.
fuel.
You see it out.
$60 a ton. They can haul 5 tons. That's $300.
Which way y'all wanna go? I'll take a motion.
Make a motion, we go with a high bid. The shadow iron and metal at $100.
Now, how long we gonna
I
do
have a
this?
motion, do I have a second?
That's for this one, just to get it cleaned up, I
Right, just this
understood.
one time to get it cleaned up.
Just to get what's out there cleaned up. Isn't that correct? Isn't that what they
Correct.
said?
Yes, and then we're gonna put it back out for bid.
Got a problem with this. Did anybody ever ask you for a high bid or just a bid?
There's an ask before bid.
That's what it is.
See, that's wrong. That is wrong.
I think this is just for, like I say, just for what's out here now, so this not.
Just what's on the hill is what they're saying.
Yes,
Right. So we have opportunity to rebid.
yes.
Okay.
Yes.
So I second Mr. Holmes' motion, and we have opportunity to rebid.
Have a motion and a second, is there any further discussion?
That's wrong. I feel like we doing Mr. Best all this. We ain't, that ain't right. Cause, we doing him a disservice. This really the truth, because if they want a high bid, they should.
Well, I mean, you gotta look at it like this too. I bring y'all trash, cause I do have dumpsters and I haul trash. I have the opportunity to go to Sabine, Caddo, but I'd rather spend my money here, cause y'all spend money with me. I mean, I'm keeping it here in the parish. I mean, and I'm spending, just like last Monday I was there. But it's y'all's decision, it's all right. I understand.
One more question. This high bid is for us to take it to the people?
No.
They gonna come
They'll-
get it.
they'll
I
come
see
pick
that
it
on the
up.
side there, that's what, I was just making sure.
It's for them to pick it up.
Y'all please vote
Y'all
now.
done with me?
Vote.
Yes, sir,
All right,
thank you,
appreciate it.
Blake.
Thank you.
Motion passes. Approve change order number 1 for the borough area preparations in the amount of $93,500 to to increase the amount of cubic yards to be moved.
I so move.
I second.
I have a motion and a second. Any further discussion? Y'all please vote now. Motion passes. Motion to adjourn.
Second.
We're adjourned.
Road committee come to order. Is there any cause for addition to deletions? I have one. Amend the corporate endeavor agreement with the town of Logansport and amend the road budget in the amount of $29,000 for the remainder of overlaying of Lovell Lane. Do I hear a motion to be added to the jury?
Is that just one thing or two?
That's just one thing.
Town of Logansport,
For $29,000 for Lovell Lane to finish the overlay project.
that's Lover Lane, you said?
Lovell.
So moved.
Ms. Burrell made the motion. Do I hear a second?
Second.
Second by Mr. Keith Parker.
Is that,
Roll.
that's for labor, right?
Can I
That's
comment?
just our labor, or?
Can I comment?
Yes,
Go ahead.
please.
Mr. Holmes, this is for labor and material. You know, we had to pay for a private contractor now because our low-down machine. Total, Mr. Phillip, is that for labor and material or just for material? Labor and material?
Labor and material, okay. Roll call vote, Mr. Holmes,
Aye.
Ms. Burrell,
Aye.
Mr. Arnell,
Aye.
Mr. Keith Parker. Raise your row, aye. That would be item number 2 on the road committee. Any guest or public comments on anything on the road committee? Road items, authorize the president to sign change order number 2 for road drainage improvements on Charlie Jones, Dial, Mount, and Nash Road, 2016 FEMA.
So move.
Second.
Motion by Mr. Arnell Jones, seconded by Mr. Jerry Burrell. Any discussion? Please vote now. Motion passes. Addition, amend the corporate endeavor agreement with the town of Logansport and amend the road budget in the amount of $29,000 for remainder of overlay and Lovelock Lane labor and material.
So moved.
Motion by Ms. Burrell. Second by Mr. Keith Parker. Any discussion?
Yeah, as, all the other CEAs we do is for labor. The town or the CEA, they have to pay for part of that.
Well, if you remember, our laydown machine is down, so we had to hire an outside contractor.
Okay, so the cost of the outside contractor,
Increase the price.
so they would have to just pay an increase in price then. That's still the way we've done it.
Not necessarily, we
I know not
increased the
necessarily.
budget to do everybody else's road. I mean, know a lot of them we increased. Up north.
Wait till we get our laydown machine done, fixed, and, then they can pay the price just like they would, do the CA just like we normally would.
Go ahead, Mr. Mitchell.
Okay, Ms. Jimmy, that was part of the ARPA money, and it would cover the whole road. So, that's why I requested that. The road committee can do with it what they wanna do with it. It's not gonna upset me either way. But we have contributed to other roads in the parish. You know, and it's the CA with the town of Logansport. And, I don't, Zach, asphalt total?
Sorry?
Asphalt total.
What's the cost of the asphalt and what's the cost of the labor?
I don't have those numbers with me. The labor is $16 per ton. I think it added another 15 loads to the cost.
No, it's not.
don't have the numbers with me.
How many
Labor
tons,
is 16.
how many tons in a load?
Sir,
How many tons in a load?
how many tons in a load?
Well,
Average
depending on-
16.
Yeah.
14 to 16.
Right.
So the labor's 256, 25,000?
No, that's total. 29 total, Ms. Pennington, I don't know what the tonnage is. Yeah.
Get this over.
Mr. Rowe. Still got a question on, we still got a question on the table?
Huh?
We still got a question on the floor?
Yeah, here's it.
You still waiting on this? Okay.
All right, any more questions?
Yeah, is this still your ARPA money? It's
It
not
is.
your ARPA money?
No, sir.
Okay.
You went could because they had
It-
that lay down machine.
Half of the road is parish, and half the road is county. So the dividing line, the center of the road.
So
But
we-
I'd like to add this too. We have $1 million surplus in the road budget for the year.
Okay,
Yeah, passes.
you wanna make an alternate motion, you ready, y'all ready to
Y'all
vote?
got the motion on the board.
Vote.
Got a motion on the floor.
All right, please vote now. Motion passes, motion to adjourn,
So move. Second.
all in favor say aye,
Aye.
we adjourn.
All right, Airport and Animal Control Committee, call to order. Call for any additions and deletions. Any guests and public comments? Airport and Animal Control items, number 1, authorize the president to sign the state project number H015175, obstruction removal runway. 36, approach Phase 3, construction CE Rusty Williams Airport Agreement and Resolution.
So moved.
Second?
By Mr. Kennington and second by Mr. Baker. Any questions? It looks like, from what,
Funded by the state.
yes, it's funded by the state. So I think they're saying that we're basically going to get the money back from DOTD. Any questions?
They voted.
All right, please vote. Okay, item passed. Motion to adjourn.
So moved.
Second.
Adjourn.
Okay. We're gonna roll right into our special meeting. We're gonna roll right down to any guests and public comments to the special meeting. Being none, any additions or deletions to the agenda?
Yes,
I have,
the ones you.
yeah, I have a couple of additions. We added at number 3, rep,
Do that one, 'cause that one got deferred,
Haven't got the third.
right?
yes, ma'am.
Yep.
Can I go to the next?
Okay.
That's what I was about to do. Thank
Okay,
you.
so
Recommend authorizing staff of 13 employees and amend the budget to help with Keep Louisiana Beautiful parish-wide cleanup on the 11th to 18th, 23.
So moved.
Got a motion by Mr. Rowe, second by Mr. Fuller and Mr. Jones. A roll call vote to add to the agenda, Mr. Fuller?
Aye.
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 All in favor, aye. So that be added to number 3 on the agenda. Okay, new business. Recommend approving the high bid for scrap, which would be Coshada Iron and Metal, pickup at the landfill.
So move.
I got a motion by Mr. Fuller,
Second?
second by Mr. Holmes and Mr. Baker. Discussion? There's no discussion. Would you please vote? Motion passes. Item number 2, recommend approving the change order number 1 in the amount of $93,500 to increase the cubic yards. Do I have a motion?
So moved.
Second.
Got a motion by Mr. Baker, second by Mr. Mitchell. Discussion? There's no discussion, please vote. Have one remaining.
It's me.
Oh.
Thank you.
Motion passes. Item number 3, recommend authorizing the staff of 13 employees and amend the budget to help keep Louisiana beautiful parish-wide cleanup on November the 18th, 2023.
So moved.
I got a move by Mr. Jones,
Second.
second by Mrs. Trina Boyd and Mrs. Burrell. Discussion? There's no discussion, please vote. Motion passes. Have a motion to adjourn?
So moved.
Got a motion by Mr. Burrell, second by Mr. Parker. We'll adjourn. Thank y'all for coming out.